Welcome back to Inspire Great Health. We hope you had a great new year. Today I have Dr. Anub John with me today from our Heart and Vascular Institute. How are you today, Dr. John?
I'm doing very well.
Thank you
Thank
so
you.
much for joining me. Today we're going to be talking about heart health. So tell me more about your position here at Cheyenne Regional.
So, I am the medical director of the Cardiac Catheterization Laboratory, and I'm also a interventional cardiologist. So, I do minimally invasive surgery to help patients who have a heart attack, for example. I also do pacemakers to help with the electrical action of the heart. Those are a few of my responsibilities. I also see patients in clinic. I help patients with cardiac conditions and help them feel better.
How prevalent is heart disease?
Unfortunately, heart disease is very prevalent. Heart disease is the number one cause of death in the United States. Unfortunately, it is more prevalent than all cancers combined. Heart disease can be various conditions. It could be heart failure, it could be a heart attack, it could be high blood pressure, valve disorders. Focusing on heart attacks alone, somebody in the US has a heart attack every 40 seconds. So it is pretty common. About 600,000 people have their first heart attack every year. About 200,000 people have a repeat heart attack every year. As far as cardiac arrest goes, about 370,000 cardiac arrests occur outside the hospital, and most of them occur at home. Risk factors include both modifiable risk factors as well as non modifiable risk factors. Modifiable risk factors are factors or things that you can change or you can make an impact. They include conditions like high blood pressure, high cholesterol, diabetes, tobacco use, excessive alcohol use, obesity, inactivity. Non modifiable risk factors are conditions that you don't have much of a role as far as changing the outcome. They include age. As you get older, your risk of heart disease goes higher. Sex. Men are more likely to have heart disease. Women, when they reach menopause, their risk goes higher and becomes the same as that of a man at that point. And then family history. If your family relative has had a heart attack at a young age, unfortunately, you're also prone to having a heart attack at a young age. And therefore, it's important to talk to your provider about your personal risk of heart attack if you have a family member who's had a heart attack at a young age.
What is the difference between a heart attack and cardiac arrest?
A heart attack occurs when the blood supply to a part of the heart muscle is affected, usually by a blood clot. Therefore, there is not enough blood going to that part of the heart. So it damages the muscle, but the heart usually continues to beat. A cardiac arrest, when that happens, there is a problem with the electrical function of the heart. So this might cause the heart to stop suddenly, and this will affect the blood supply going from the heart to the brain and other vital organs. A cardiac arrest can be fatal. A heart attack can lead to a cardiac arrest, but both are not the same.
What are the signs of a heart attack, and what should someone do if they are experiencing these signs?
Some of the common signs of a heart attack include chest pain or pressure or discomfort. It could radiate to the arm, the jaw, the neck, and sometimes even to the stomach. It is usually associated with shortness of breath. The other symptoms include fast heart rates, irregular heart rates, feeling very tired, cold sweats, nausea, or vomiting. Women sometimes present with atypical symptoms. They may not always have chest pain when they have cardiac issues or a heart attack. They might present with neck pain or jaw pain or just back pain without the chest pain, or just shortness of breath, nausea and vomiting, or just feeling very tired. So it's important to have a low threshold for obtaining an EKG when the patient presents to the emergency room with any of these cardiac symptoms to make sure they're not having a heart attack. If you think that you or someone that you know is having a heart attack, you should call 911. Emergency medical services can offer you life-saving medical treatment sooner than you driving yourself to the emergency room.
Why should someone take aspirin if they're experiencing these symptoms?
Aspirin is an antiplatelet drug, so it helps prevent platelets from clumping together. So it prevents the blood clot from getting bigger. So when you're experiencing a heart attack, it is most likely from a blood clot that decreases the blood supply to the heart muscle. So when you take aspirin or you chew a full regular aspirin, it prevents the clot from getting bigger, and therefore you are already starting the treatment way before you reach the hospital.
Why is it so important to perform CPR if someone is experiencing heart attack or cardiac arrest symptoms?
When somebody has a cardiac arrest, if the heart stops, if the heart is not pumping, then there is no blood that is going to the brain or other vital organs. Even a few minutes without blood or oxygen, the brain can have severe, irreversible damage. So it is important to perform CPR or chest compressions to help restore oxygen-rich blood to the brain and other vital organs. It can even double or triple your survival rates after a cardiac arrest. So it is very important.
So, tagging on to that CPR, what if someone doesn't know how to do chest compressions?
So CPR consists of two things. One is to do chest compressions, and the other one is to give mouth-to-mouth breaths to help with the oxygenation. The current recommendations is to at least do chest compressions. Even if you don't do mouth-to-mouth breaths, you have to do chest compressions. And chest compressions are relatively easier to do. So even if you don't know how to do CPR, you should do chest compressions. You should push hard, push fast, push in the center of the chest at a rate of about 100 to 120 compressions a minute. And you should keep doing it till the emergency medical services arrive to help.
And what is 120 beats per minute?
There is a very famous song, Staying Alive. And if you remember that song, you can sing. And to help with the rhythm, the tempo of that particular song is 120 beats a minute.
Perfect. All right. So, "Staying Alive" by the Bee Gees is a good song to remember when doing chest compressions.
Yes.
Okay. Besides performing chest compressions, how else can we help someone who is going through cardiac arrest?
You should call 911 at the very beginning. The dispatcher will help you save the patient. They will tell you what to do. They will send help your way. You should also get and use an AED, an automated external defibrillator, if available. So AEDs are usually available in most public places. If you go to a department store or a public library or a regular store, there should be an AED there already.
What should I do if I'm alone and I start experiencing these symptoms?
Call 911. We also recommend that you leave your front door open so that emergency medical services can come in. And it's best to either sit or lie down when this happens. And after you've spoken to the dispatcher in 911, if they recommend an aspirin, you should definitely chew a regular full aspirin while you wait for emergency medical services to come.
Is there anything else you would like to share?
If you or anybody else that you know is having a heart attack, please call 911. It is very important. Time is muscle. The longer you wait, the more the damage will be to the heart muscle. It is also important that everybody takes an AED and a CPR course. You never know when you can be of help to your loved ones. So it is important to know how to do CPR and help the loved one if it comes to that.
Thank you so much. You've been so informative today. I appreciate you taking your time to educate me as well as our community about heart disease.
Thank you.